Welcome to my podcast. Today I'm going to talk about another important case here in the UK. So after you introduce yourself and double check the patient name, date of birth, it could be the patient themselves, it could be the relative, it could be the family, who might say that, doctor, I noticed that this person is not acting himself recently, or they are like not concentrating, or they are like impulsive or aggressive, or very sleepy, calm, withdrawal. So all of that will pinpoint to delirium, which is a common clinical sign of cognition decompensation, featured with acute changes in the attention span, cognition, disturbed perception, and can be seen acutely and fluctuating. It could take like 1 to 2 days to develop and manifest, and of course, it's a serious manifestation and can be linked to poor outcomes as well. So in that concept, we need to address the underlying cause in order to attempt to modify the impact and mitigate it. It has been found that the prevalence is around 20% of adults in the acute general medicine, and mostly and higher more in the acute, which is the intensive care unit. And it's more associated, of course, with people who had hip fracture, and up to 75% in the intensive care unit. Of course, it can be manifested as hypo or hyper, and I mean by that, it could be the patient that very arousal, restlessness, agitated, aggressive, or it could be the opposite, which is withdrawn, quiet, sleepy. However, in certain situations, could be a mixed, which can make the condition hard to be diagnosed or recognized. And the risk factor that you need to probe around is the age, of course. So any patient who's 65 or over, who had manifested with certain strange behavior, could be related. Also, if there is any cognition impairment, or if there is any history of recent hip fracture, or a history of severe illness. So in that regard, you need to take a thorough history, and essential to understand the functional state of the patient in order to get an idea what has happened. You could also check with the relative or the family and see if the condition is acute or not, and if it's fluctuating. So you need to assess the patient as a whole and include the cognition. Say, for instance, if the concentration has been worsened, or there's a slow response, or there is confusion state. Also, you need to check the perception, if there is any visual or auditory hallucination. And of course, the physical functionality in terms of mobility, movement, and restlessness, which could be all impaired and decreased. And the agitation state, and if there is any change in the appetite, for instance, if they're not eating, and if they have any sleep disturbance, whereby sometimes they might have a problem falling asleep. In terms of the social behavior, you need to look for instance, for lack of cooperation with reasonable requests, and if there is any withdrawal, altered communication, and in terms of the mood and attitude behavior as well. And after you rule all of that, you need to check medication-wise. If the patient has used medication for some time, and if there is anything has been modified or a recent introduction of some drugs, and if there is patient with history of falls or sleep deprivation or any other illness that can manifest in that condition. And then you need to ask that you need to check the patient. So you need to check the patient systematically. And I mean by that, you need to check the cardiovascular system, respiratory system, neurological system, mental state, musculoskeletal condition, and if there is any skin manifestation. And review the medication, in terms to manage and underlying condition. Ensure the patient can move or mobile, not bedridden, and eliminate if there is any issue of pain element, so it has to be controlled, and also promote and advocate for sleep hygiene and maintain hydration and ensure that the bladder and the bowel, they are regularly evacuated, and give oxygen if there is a need for that, and always ensure the natural environment factor, which is, I mean by the urinary fluctuation and the natural lightening, which could affect, of course, anyone's mood or behavior. So that's in brief. If I come across a case whereby a patient has acted differently from their usual, so this is certain points that you need to think of and try to assess according to the situation. Thank you.